About 1 man in 9 will be diagnosed with prostate cancer during his lifetime. 1 in 9. Other than skin cancer, prostate cancer is the most common type of cancer in American men. Prostate cancer can be a serious disease, but most men who are diagnosed with it do not die from it. Close to 3 million men who have been diagnosed with prostate cancer at some point are still alive today. I'm Dr. Stephen Graham, a board-certified urologist, and my partner, Dr. Brad Lake, and I are going to discuss what you need to know about prostate cancer. If you relate to anything in this video, please contact our office. What are the risk factors for prostate cancer? It is not clear what causes prostate cancer, but we do know other factors that can increase your risk for prostate cancer. In addition to a PSA above 4, other risk factors include age. Your risk of prostate cancer increases as you age. Race. African American men are at a greater risk of having prostate cancer and a greater risk of having more aggressive prostate cancer. And family history. If men in your family have had prostate cancer, including a brother, father, or uncle, your risk is increased. What are the symptoms of prostate cancer? Prostate cancer typically does not cause any signs or symptoms in its early stages, but as the cancer advances and moves outside the prostate, you can develop symptoms. If you're experiencing any of these issues, you should discuss it with your primary care provider or urologist. Problems urinating, such as slow or weak stream, or the need to urinate more often, especially at night. Blood in the urine or semen. Persistent pain in your hips, back, or other bony areas. How is a patient diagnosed with prostate cancer? According to the American Urological Association, men between the ages of 55 and 70 should have an informed discussion with their primary care provider or urologist about scheduling a PSA blood test. Screening for men between the ages of 40 and 55 should be individualized based on their risk factors for prostate cancer. If men have a PSA level between 4 and 10, they have a 1 in 4 chance of having prostate cancer. If a man has a PSA greater than 10, that risk goes up to almost 50%. A digital rectal exam, or DRE, is also part of the screening process. This is where a provider inserts a finger into the rectum to feel for any abnormalities on the prostate. The exam can be uncomfortable, but typically is not painful and is done in a matter of seconds. If your PSA test or digital rectal exam is abnormal, your urologist may order additional tests, including a prostate biopsy, to determine if prostate cancer is present or not.
Hi, I'm Dr. Brad Lake, a board-certified urologist. As Dr. Graham mentioned, prostate cancer can be a very serious illness. However, when found early and still confined to the prostate cancer can be treated very easily with very high cure rates. So what happens after you're diagnosed with prostate cancer? We will first determine how serious it is and develop a treatment plan for you based on pros and cons of treatment, and then pick a plan that best suits you. It is extremely important for you to weigh the risks and benefits of each treatment option. But fortunately, we will be here with you the entire way to determine what's right for you. So once diagnosed with prostate cancer, people want to know what they can do about it. The first thing we need to do is determine your Gleason score, which is a grading system for prostate cancer. Once we determine your Gleason score, we can develop a specialized treatment plan for you. Treatment options for localized prostate cancer, which means cancer still contained within the prostate, include active surveillance, radiation therapy, and prostate removal surgery. So first, let's talk about active surveillance. If you meet criteria for active surveillance, we basically watch your cancer. We see you back at regular intervals with PSA tests, prostate exams, prostate MRIs, and eventually a repeat biopsy. You can elect treatment at any time along the process. If your cancer looks to be getting more aggressive, we will often recommend treatment. Active surveillance is very safe when done appropriately without increased risk of spread before treatment. Next, let's talk about radiation therapy. There are two main types of radiation therapy for localized prostate cancer. There is brachytherapy, commonly known as seed implants, and also external beam radiation therapy. Both of these treatments are delivered by a radiation oncologist. We can easily refer you to meet with one of these doctors if needed. For those patients who elect to have their prostate removed, we do this through a surgery called the robotic prostatectomy. This is surgery where we remove the entire prostate, the seminal vesicles, which are the structures adjacent to the prostate where cancer will most often spread to first. We also remove the lymph nodes, which will aid in prostate staging. Greater than 90% of radical prostatectomies are now done using the Da Vinci robotic system. Dr. Graham and I are both trained in Da Vinci robotic surgery. Robotic surgery to remove the prostate is a great option because it allows for a more precise surgery, less bleeding related to surgery, less pain post-operatively, and a quicker recovery time. Most patients typically spend just 1 to 2 days in the hospital and are back to their normal routine in just a few weeks. When cancer is detected at a more advanced stage, typically involving the bones or lymph nodes, we don't do the same treatments as we do for localized prostate cancer. In these cases, most patients will receive an injection called androgen deprivation therapy. This is done at regular intervals in the clinic setting. Every patient wants to know what their life is going to be like after being diagnosed with prostate cancer. The most important thing to remember is that the majority of patients will not die of prostate cancer. Most patients are back doing the normal things that they love shortly after treatment. After your prostate cancer has been treated, we will develop a care plan that's appropriate for you. This typically includes routine follow-up exams and other testing. It's important to remember that your PSA will need to be monitored for the rest of your life. So routine follow-up with your urologist after prostate cancer treatment is extremely important. To make an appointment with us at North Shore Urological Associates, please call 985-230-7864 for our office in Hammond, or you can call 225-686-4960 for our office in Livingston, or visit us online for more information.